Hello, thank you for being here today. Before we get started, I wanted to take a minute to take care of some housekeeping items. First, we will be running the live Q&A at the end of this webinar, so we have enabled the Q&A feature in your webinar controls. If you have any questions, just pop them in there. And if you miss anything, don't worry. We'll be sending around a recorded copy of this presentation tomorrow. Let's get started. Welcome to today's webinar, Rebuild Patient Volume Quickly and Safely. I am Emily Nelson, VP of Marketing at QDoctor. I'll be your moderator today. It is my honor to introduce you to our presenters. Nick Redman is the VP of Health Center Performance at Hudson Headwaters Health Network. Nick oversees a network of 19 community-based health centers with an annual volume of 400,000 patient visits. John Dudley is the Chief Information Officer at Hudson Headwaters Health Network. John oversees and implements the technology requirements for the network across a large geographic area for approximately 900 employees. And finally, Patrick Randolph is the founder and CEO of QDoctor. Patrick is responsible for delivering the industry's only fully autonomous AI-enabled scheduled management solution. Thanks for being here. I'll turn it over to Patrick.
Thank you everybody for joining. I'm Patrick from QDoctor. And I'm going to kill a couple seconds while everyone gets it. I know some people had their meetings run over. Today, what we're going to focus on is rebuilding. But we're going to focus more on rebuilding and how Hudson Headwaters Health Network did it. Hudson Headwaters is a phenomenal example for, no matter what size you are, EMR, where you're geographically located, because they have a bit of everything. They have many offices, they're an FQHC, they have 150 providers, but they're slightly decentralized. And so they have lessons to teach whether you're a smaller practice or a large health system. And so I'm really excited to have them join us. And they've been very successful in the rebuild, and I'll let them speak to that. And that's another thing that we're really excited to have them for. Before we jump into that, I want to say a quick word on QDoctor. QDoctor is an AI schedule management solution, and our goal is to help you build your patient volume back up. Pretty simple. What makes this crisis a bit unique, which we'll talk about, is that this didn't just hit patient volume, but also hit the staff side. And so many of you in the recovering phase are dealing with reopening. And the issue is that some patients are coming back, right? We'll talk about the patient surge in a bit, but your staff might be furloughed or they might be working from home still. So staff productivity isn't quite there. Understandably, we're all focused on slightly different things. And that's what makes COVID unique, is that it didn't just hurt the demand side, but also the supply side. So that became another layer of challenges. Also, of course, the time it went on. I was talking to a COO the other day, and he said, if I hear the word COVID-19 one more time, I'm going to scream. And I imagine a lot of you feel the same way, but it is the reality right now. And, the three phases that we're going to walk through here, and you are probably at either phase 2 or into phase 3, is first was the move to telemedicine, right? A lot of you, if I had asked you guys before this, could you adopt telemedicine in a week? You would have said, absolutely not, it's impossible, it might take a year. But many of you did just that. You moved to telemedicine, you built up the patient volume. But of course it wasn't enough, it couldn't 100% compensate for the in-person visits. So now, many of you, depending on your geographic location, are in different phases of reopening. Some of you reopened at once, some of you reopened over 4 to 6 week periods. And that looks like a mix of in-person and telemedicine. So the goal now is putting people back to work by rebuilding patient volume. So what I'm hearing, from a lot of our customers, and Nick and John will speak to their own experiences, is phones are ringing off the hook, right? There's a lot of patients calling back in, a lot of patients trying to get in the office. And of course, due to social distancing, you don't have as many slots as you used to. And so there's that patient surge of too much patient demand, but not enough supply, not enough slots to offer them. Right, so we'll talk about how to deal with that as well. The good thing, if there is any in there, there really isn't, but a good thing about a crisis is it allows you to focus. And I think it's a lot of folks, especially you all here, to focus on we need to rebuild patient volume. Let's put our resources towards that, because that puts your staff back to work. That means more patients get taken care of. There's a Crow study that I think was really helpful, and this is important to remember, and I know a lot of you already know this, but they estimated that to fully recover the patient volume lost, you'll need 110% of previous capacity for the next 6 months. And that's important, because even though the patient surge is happening right now, you want to think not of just the next month, the next 6 months, the next year, how to maintain that high level. And so the changes you make aren't just one-time changes. Changes that are going to help your health system and medical organization thrive. But I think the most valuable information comes from people who are doing it. And so I want to kick it over to Nick Redman over at Hudson Headwaters. Nick?
Great. Thank you, Patrick. Appreciate the introduction and the opportunity to be here and speak with everyone today about Hudson Headwaters Health Network. We're, like all of you, back in March when this was sort of starting to unravel here in upstate New York. We're about 3 to 4 hours north of New York City, where we saw what was happening. And we were certainly quite aware that this was probably going to spread across all of upstate at some point in time. And we were really watching closely and monitoring what was happening. And then the first thing that sort of happened, I want to say it was March 16th, was it was a Saturday, Friday or Saturday, I can't quite remember which day. There was an announcement that all of the schools were closing in our area. That's when we really knew, oh my gosh, this is for real, and we really need to sit down and spend some time together and think this through. So everyone on the executive team got together on that weekend. We spent probably 6 hours sort of mapping out what the next several days was going to look like here at Hudson Headwaters across the 19 health centers that we operate. And really the first thing that we started to think about was how can we maintain and provide a safe environment for our employees and our patients, while also trying to come up with creative ways to ensure that we were going to be able to still maintain some level of care, because we have about 90,000 patients that we provide primary care and some specialty services to. So it was really a team effort to sort of come up with that. But at the onset, we realized we're going to have to cancel a lot of appointments. And that first month, we ended up canceling about 8,000 patient appointments, which was something that we've never done. And not only were we canceling, providers were canceling, patients were also canceling. So on the heels of that, it's, well, how are we supposed to balance the staff? So we had met, and we ended up, we wanted to make sure that we had a safe process for our employees. So we ended up furloughing several employees. It was 87 employees in total. And we still maintained our clinical staff because we weren't sure of the surge in our area. So we wanted to make sure that we were a safety net as an FQHC. That's who we are and what we do, but also to help support the hospital should there be a serious surge. We also were in the process of removing our headquarter work staff to remote work. We were able to do that within a few days. We moved about 160 employees to remote work, and we ended up with about 20 to 25 people being on site. So it was an incredible effort by John's team and our IS team to really configure all that relatively quickly. We ended up setting up tents at centralized locations to meet the demands, but at the height of the onset, we were down about 30% of our pre-COVID volume across our network. So that was a scary thing to see for us. Next slide.
Thanks, Nick, and thank you for everybody for joining. We know it's still a really busy time for everybody, so we really do appreciate your time to listen in on our story. This is John Dudley. I'm the Chief Information Officer here at Hudson Headwaters, and as Nick mentioned, we all have sort of those moments in time that live in infamy in our lives, and at Hudson Headwaters, those first couple weeks of March are one of those times. So that first, second week of March was we saw our volumes really start to drop off with patients canceling, and with us evaluating, who are the patients who really need to be seen, and for those patients who can wait, let's keep them out of the office and keep them safe. Our Chief Medical Officer was really concerned about, maintaining access to care. during times where, patients weren't going to be coming into the health centers. And luckily, around that same time, we were seeing really rapid regulatory relief. Up until that point, telehealth was on our radar screen, but as an FQHC, it's not something that was a reimbursable service for us for the most part. So we hadn't really seriously investigated, a large-scale solution. But that first week of our patients not being seen in the health center and our CMO becoming very concerned about, maintaining access, he challenged us that by the middle of that next week, he wanted to have a telehealth solution on the table that we could work with. And as Nick mentioned, to complicate things that weekend when the announcement came in that our schools were closing, we had to really evaluate our workforce and how that was going to impact our workforce and those who might have childcare issues. And that's when we really rapidly, in addition to trying to spin up telehealth, had to, establish a robust remote workforce for both childcare issues and, again, to keep our employees safe. But by March 20th, we were seeing our first telehealth visits. And the model that we sort of were piloting was a centralized model with dedicated hardware, dedicated support staff where providers could come and do their telehealth visits. And while that worked well on a small scale, we quickly realized that, as an organization with 19 health centers and our two most distant centers a couple hours apart, that was not going to be scalable and meet the demand of our patients and our caregivers to maintain contact with patients. So we, quickly again did some web meetings, some trainings, sent out some documentation, and really challenged our staff across our network to kind of take this on and make it work. And the way our providers and staff responded to that was really inspiring. And before you know it, we had a really robust telehealth service spun up. And we had already had a relationship with QDoctor at that point. It's a product that we were using to help us fill cancellations. When patients would cancel an appointment, QDoctor would automatically just reach out to patients on a wait list and offer them that slot. And something that Patrick and Nick and I had talked about was a solution to text patients that had upcoming visits and offer a telehealth option to them to flip that in-person visit to telehealth. So, that quickly rolled out, and we were able to reach out to a lot of patients without any sort of resource needs because, again, we had furloughed staff at that point, so we were trying to be as efficient as possible. And, we were able to reschedule a bunch of visits at that point to telehealth. So next slide.
Previous slide, please, Patrick. So when you think about what we were sort of up against, thankfully we didn't close any of our health centers. We thought we may have to as we were preparing for what might actually come, but thankfully we didn't have to do that. But when you think about reopening to what you were pre-COVID, there's a lot of factors to consider. What does the phasing look like? What does the patient volume look like? What does the workforce look like? How are we going to ensure safety for our employees and patients? What type of workflows needed to change to be able to accommodate the demands in a safe and appropriate way? How would we balance visits and be able to still ensure that our patients were well taken care of? Those were really the big questions that we had to grapple with early on. And we all were fairly consistent on one idea, though, and that was that we had to really leverage technology to do this. And we've, over the past several years, have really taken a good look at where our limitations are, not only geographically, but within each of our sites. And we've been slowly implementing different technologies. As John said, QDoctor was one that we had brought on last year. We're also looking at a different platform for telehealth. But the idea here is that we knew that we were going to have to do that. And we, at the height of this, back in April, we were seeing approximately 50% of our total visits were telehealth and would either be audio to a smaller extent, but video as much as we could. And the great thing about it, as John said, was we saw a significant number of patients switch their appointments, which was nice. And that allowed for a safe environment for patients and a safe environment for employees. We were able to slowly get different safety measures in place, such as sneeze guards. We have door screeners for screening questionnaires, making sure we're filtering out high-risk patients. We had set up some tent sites, as I said before, at centralized location. We came up with some different protocols for symptomatic and asymptomatic testing. And most recently, we've launched self-administered testing at several of our sites, and we'll be rolling that to all of our sites here over the next week to 10 days. But ultimately, we did see that a lot of patients were very comfortable switching to a video visit, which was almost prior to COVID was somewhat of our apprehension. We had some, FQHC requirements that precluded us from doing it, but there's always that natural resistance to think that not everyone will adopt this. But when it comes to a situation like the pandemic we've been dealing with, it's really forced not only providers to adapt, but also patients. Next slide. So rebuilding patient volume is something that we've been really focused on, as every organization has been. And to that point, the switch technology that we had worked out allowed us to convert future appointments to virtual appointments. And we actually were able to switch, it was about 2,500 appointments during the months of May and June into video appointments quite autonomously with a text, which was really great and a very good reactive process to meet the demands that we were seeing. And we were really thankful that we were able to do that, because we were thinking about the amount of employee staff that we had at the time, with the significant number being on furlough. And we were trying to come up with an efficient way to be able to do this. And that really helped set the stage for us and how we were going to utilize telehealth going forward. The idea of continuously making phone calls to patients, we found over the past 2 years, is something that we're really trying to migrate away from, as most patients want to utilize their phones. You think about personal experience. You have a phone call come in, the odds of you answering it, unless it's somebody you know, is probably quite low. So we really wanted to come up with ways, to be able to do that for our patients and make it easier for them during this time. And that was a really easy process for us to stand up, and we saw a great return on that. We actually turned on the QDoctor cancellation functionality a few weeks ago. We had that turned off because we were trying to avoid having patients come in unnecessarily. But what we've seen just by flipping the switch and turning that functionality back on, we've seen huge pent-up demand for patients to want to come in for an appointment, which has been really, really favorable for not only Hudson Headwaters, but really for our patients. And being able to provide that level of access to them to see their providers at a more convenient and earlier time has been very well received by all of our patients. Next slide.
And as Nick mentioned, we constantly evaluate how technology can play a role in our organization, especially because we are spread out. We cover a large service area. I've been in healthcare IT for over 30 years and really never thought I'd live through something like we have the last 3 months. But if you had to call out a bright spot, it's really been impressive to see the rapid innovation from our technology partners and solutions that have come to market almost overnight to help organizations like ours manage this crisis. For example, as we look to bring patients back in, we also want to do it in a meaningful and careful way, because we do know that there's a segment of our population, the elderly, and those with multiple chronic conditions that are higher risk once they contract COVID for really severe complications. So, an instance of an example of a rapid development of a tool was, an analytics vendor that we work with developed a COVID risk tool. So looking at our patient population and those patients who are scheduled to come in, assigned a risk score based on, multiple factors, including age, multiple chronic conditions. And we can take a look at that in advance of patients coming in, as we use technology, but still have a set of eyes looking at those patients who are coming into the center to be able to determine those that we may still want to offer that telehealth service to. So, again, the combination of, a rapid need arising, some accompanying deregulation has really contributed to some tools that we've been able to take advantage of, and QDoctor being at the forefront of that. Next slide.
So we had set out to have a goal. We were starting to see, really this was a lot of, our being able to reestablish patient volume was predicated on the current rate of infection within our communities. And thankfully up here, knock on wood, we've been seeing a really significant decline to the point where we've had just one positive case in our county in the last 3 weeks, which has been very encouraging to see, especially with the hotspots that we've been seeing across the country over the past couple of weeks. So for us, we've really seen about 85% of our pre-COVID volume come back over the last 2 weeks, which has been very encouraging, and it's been really great for our patients along the way here. We have seen a decline in telehealth, which sort of makes sense because we've been able to get more patients in for those in-person visits, which many patients demand. And as we look at the balance going forward between in-person and telehealth, we sort of anticipate probably 15 to 25% of our visits, depending on geographic location. We anticipate those continuing in the telehealth format. So it's something that we're sort of figuring out how to do, because you look at it and say, well, the necessity may not be there, but for the advancement of primary care and how patients will now expect this, and as the regulations and the payers soften up a little bit, it's something that we feel is going to be really important for Hudson Headwaters and how we deliver care to our patients across the 5,600 square miles that we service here in upstate New York. And a majority of the volume that we're not seeing isn't so much on the primary care side. It's really out of our 2 urgent care locations, which we've sort of come to terms with because there is not a lot of activity, sporting events, and kids playing sports and summer camps and things that would oftentimes potentially require an urgent care visit just aren't happening yet. But on the primary care side, we're seeing really that demand come back quite heavily, even in the summer months where we typically see a decline, with people not traveling and having to delay care over the past several months. It has really come back quickly, which was very encouraging for everyone. We've been able to bring back our employees off of furlough. We no longer have anyone furloughed, and it's certainly a bright spot after a dark period of 3 months. So we're really excited to see what the future holds, and hopefully our infection rates continue to stay low here in upstate New York. Next slide.
So as Nick mentioned earlier, that early part of the crisis in our region, we canceled 8,000 patients from their visits, and that created a new problem for us at this point. And it's like, okay, how do we now go back, identify those patients, and try to get them back in and back into the care loop? The last thing we want to do is, as we rapidly canceled visits and appointments, we don't want to lose those patients to care. Many of our patients are elderly, they have chronic conditions. We have a cadence of seeing them and getting them back in the office, and we really don't want to lose that. So that presented a new problem with us. Okay, it's going to take a lot of man hours to go back, identify all those canceled patients, reach out to them, try to get them scheduled. And that's where QDoctor comes in again and asked us to participate in a beta of a tool that they were developing, and we certainly were very happy to do that. And one of the benefits of QDoctor is it's fully integrated with our electronic medical record and practice management system. So, through their web portal, they were able to create, an app with a user interface that showed our configuration that comes directly from our scheduling system, which allows us to go back in time and select a date range of when these patients were canceled. So for instance, we could pick March, select what types of visits we want to encourage our patients to start coming back for, and also look for things like why was the visit canceled. So maybe there was a legitimate reason why the visit was canceled, and we don't want to necessarily reach out to that patient at this point. And we also want to exclude patients who, subsequent to that canceled visit, have been seen either virtually or in person. So given all those parameters, we can then select a future range of dates, and then those patients are going to get a text message that offers them a couple different options for rescheduling that visit. And just by responding to the text, are able to get that visit rescheduled. And that's key, because again, we can do all this without staff resources. Our vision, our ongoing vision for our technology is to bring the consumer more of what they're used to in other industries. So you can schedule a dinner reservation on OpenTable, you can schedule a haircut online, you can schedule service for your car. We want to have that same kind of experience. And healthcare doesn't necessarily have the best reputation for adopting technology, but we think we're getting there. So we're in the process now of working with the beta. We're tweaking things, we're evaluating results, we keep moving forward and utilizing this tool, and trying to optimize it the best we can to help us, again, reopen, get our patients back in, and not lose patients to care, which is a real priority for us. Next slide.
All right. Thanks a lot, John. I appreciate it, and Nick as well. For those of you, which I assume all of you, who really enjoyed that, feel free to ask questions in the Q&A, and we'll have Nick and John answer them. We did, something similar to this webinar a couple weeks ago, and since then, a lot has changed, right? The focus, you heard it from Nick and John now, is the offices are opening. It's a little less on telemedicine, and it's not only rebooking, but also dealing with the patient search. And we designed our product, and with help from customers, and specifically Hudson Headwater, we've been building tools in anticipation of these things, and that is handling the patient search. It is making sure that the office of the future, which is half, a fourth telemedicine and 3/4, in person, making sure that's easy, and handling the operations behind that. And so, if you are interested, right, this isn't meant to be a sales pitch. We can schedule a one-on-one demo. So reach out to us. We'll walk through our products that fill gaps in the schedule, get patients in earlier, and also can help you rebook your COVID cancellations and other ones. And doing that while being fully automated, which is important, as you all know right now, with not everyone is at 100%, and frankly, staff just don't have the time with the phones ringing off the hook to get to all the tasks they want to. And we saw in the beginning kind of the quote that says, you don't just want a one-time bump in patient volume. You want a sustained bump. And so, phenomenal medical organizations like Hudson Headwater have been utilizing this time to implement the change they was wanting to, right? And I think it's really paying off for that. And I think it's also a good lesson to learn, as people are recovering, is this is an excuse to implement those changes, be ready for the new normal. My father used to yell at me when I was lazy about reading and say, those who don't know history are doomed to repeat it. And so I always try to look for similarities to see what the future will hold. And from an economics perspective, what the tech companies went through in 2001, 2002, is similar to what medical organizations are going through now. Not health-wise, but economically. Right? There's an existential threat to the business model. There's complete change in care delivery. And also there was a bit of a flattening, right? In 2001, 2002, everyone had a website. Everyone could deliver goods, right? It wasn't enough to say, we're X business, but we're online, right? And so, on top of that, whether you were good or not as a tech company, everyone got hit. They lost 90% of their value. but looking at those who, thrived coming out of, that period can hold some lessons for, you all right now, so that you're set up from now, for the next years, so you're able to thrive. And Amazon's a great example, right? You can see their stock right there. And one of the things that Amazon focused on is they pressed their key advantage, right? And that was convenience, right? Again, everyone could deliver, everyone had a website. But what Amazon decided, that wasn't good enough. We're going to take it to the extreme. We're going to remove every single barrier between the products we're selling and the customers we're selling them to. If we do that, we will end up with the most customers, because no one is ever going to say, oh, they got it done too quickly, too conveniently. It's just not going to happen, right? And so for them, 5 clicks to purchase, forget it. They patented 1-click purchase. So for you, forget having people download apps or signing up for things. Meet patients where they are, text message. Instead of having, to hire too many people and, having inefficient inventory, they implemented robots alongside humans. Right? And that's where you want to look into automation to, as we say, Hulk out your staff, make them 10, 20, 100 times more productive, because they're working their butts off right now. And for them, everyone could deliver a package in a week. They said, no, we're getting it down to a day, sometimes an hour. Right? And so for you, focus on, forget getting patients in a week or 2 weeks, right? They might go elsewhere, they might forget. Get them in today, get them in tomorrow. And those are the things you want to focus on as you're thinking about, what your future holds, what your priorities should be, right? As you are rebuilding, how can you rebuild, but also thrive from this? And focusing on removing the barriers from the patients and the providers, right? Not just through telemedicine, but operationally. Making that patient experience as seamless as possible, so that you guys can thrive. You have, all the patients, they become patients for life. So I want to thank Hudson Headwater for joining us. We're going to open up to Q&A. I mentioned if you guys do want to request a demo, qdoctor.com, you can do that. But right now I want to open it up to questions. And again, thank you very much to John and Nick for their part, and it was amazing.
Thanks, everyone. All right, we've got a couple questions here, but if you have other questions that aren't asked, again, just in the webinar controls, you can hit the Q&A button and then just type them in. Patrick, we'll start with you. Which EHRs do you integrate with?
Great question, right? That's the big question right now. So Hudson Headwater uses Athena Health. So Athena Health is one of our oldest and best partners. We also integrate with Allscripts, Cerner, GE Centricity Business, Greenway. Oh, geez, I might be forgetting. Modernizing Medicine. And so we try to be, where all the users are, so we can provide that automated experience.
And I'd like to also add Epic to that list.
Epic. Oh, geez, I'm sorry.
Let's see. For John and Nick, has it been easy for your patients to adapt to the technology? I'm assuming younger patient panel that is easily adaptable to use the technology. I'm assuming you, have a younger patient panel that is easily adaptable to the use of technology.
Yeah, that's, I'll kick it off here. I think that's sort of the common default is that, well, we have older patients, it's not going to work for us. We actually, we're sort of age agnostic when it comes to people using the texting feature. And in fact, we have a lot of different opportunities to interact with our patients. We have a patient advisory council that we meet with from representatives of each of our health centers, which oftentimes are patients in the 65 and older crowd. And every single one of them, I would always ask at the onset, how often or how many of you, have a smartphone? And it's always whatever the number is, 10 out of 10, 8 out of 8, 7 out of 7, however many participants we have. And they all are eager to use it, want to use it. And really the idea that, it's only for younger people is really, it's just not accurate anymore. And we've had patients, utilize our telehealth services who have been in their 90s, interestingly enough, and, needed to see their provider. So people are very adaptable. And I don't know if John has any other comments on that, but.
Yeah, I do think that's sort of a barrier that we have to get over, culturally, that, we all think, oh, it's only going to be our younger population that takes advantage of the tools. But like Nick said, the first week we were rolling out telehealth, a provider came out of the office and said, well, I just completed a visit with a 90-year-old and they were by themselves. And when you look at our portal adoption rates, the largest segment of our patient population who have, adopted our portal are 65 and up. Now, they obviously are a pretty big segment of our population and arguably the neediest, but, they don't shy away from the technology. And even, my own parents and my father-in-law are all in their 80s and they're constantly on technology, whether it be their iPhone or a computer or a Kindle, whatever they might be using. So I think, trying to give our patients more credit than we do to be able to take advantage of these tools is really important.
Yeah, that's great. Another one for John and Nick. Were there particular challenges implementing this type of technology at Hudson Headwaters, especially since there are so many locations and so spread out?
Well, I think when it comes to, QDoctor that was a pretty, it didn't really affect a whole lot of staff because of its, autonomous nature. It really made it easy to implement that piece of it. We really just did a lot of WebEx training. We do some centralized training for all of our sites. We've really adopted WebEx and Zoom meetings for all of our staff. It's really been somewhat embedded in what we do, just given the geographic challenges that we're up against. So that part was relatively simple to do. I'll let John talk about the telehealth implementation.
Yeah, again, because QDoctor is really seamless to us, it all kinds of runs in the background. Like Nick said, there's really not a whole lot of regional challenges to that. Spinning up a telehealth program certainly provided challenges because we didn't have the manpower or the time to be on site at 19 different locations over a quick time period. And there were certainly some big workflow changes on staff and providers to be able to do virtual visits sort of seemingly overnight. So, again, like Nick said, we do take advantage of computer-based web trainings and, documentation, and we try to be on site whenever we can to, provide that elbow-to-elbow support. But, this was really a unique time, and we relied on staff. Every center has, different varying degrees of comfort with technology, and those who are very comfortable stepped up and helped us on site at each location and, to overcome those challenges in a time of real need.
That's great. I'm going to wrap here. We're getting we're kind of over on time here. So where do you see digital healthcare in 2021? If all three of you could weigh in on that, I'd love to hear your opinions.
Certainly.
Yeah, so this is John. I'll kind of start. As I said before, healthcare doesn't really have the best reputation for adopting technology. We're an industry that's kind of viewed as lagging the rest of the world, but I think we have been changing, and I think again, I hate to call it a bright spot because there are no real bright spots to this crisis, but the rapid adoption and development of technological tools over the last few months has really been impressive, and I think it really kick-started an evolution in how healthcare is going to change. And like Nick said, we've even started to really look at ramping up some other technology tools that we've been talking about for a while, but we sort of internally even have this cultural sort of resistance to moving too fast on the technology front. And again, I think it's sort of because we service a lot of elderly patients who we just don't think can adopt technology. We're just seeing that that's a myth. So I think there's going to be a lot more home-based interaction with the healthcare service delivery model on the patient side, and patients are going to be able to communicate with us better through technology. They're going to be able to have access to care. They're going to be able to be seen in the comfort of their own home, and you know, again, the regulatory landscape is going to be much different in the future than it is today. You know, pretty much regulation has gone by the wayside and it's the Wild West. So we have to figure out where that sweet spot is of, you know, when regulation starts to come back and it's reined in a little bit, how do things exactly look? But I really think you're going to see a lot more of that innovative type work and have a consumer experience similar to what you're seeing with the Amazons of the world and other industries.
Yeah, I think I don't need to add much to that. John hit it out of the park. And I think the important thing for healthcare to remember is that, you know, we have high touch digital experiences in every facet of our lives currently. And to think that healthcare can sort of be on an island with it will be devastating to organizations. So I think even you know, in our area where it's you know, we have geographic challenges, it's something that we're putting a lot of effort into in multiple areas, and really thinking about how the whole brick and mortar experience is rapidly changing. And we've been saying that every year, and it continues to evolve faster and faster. So, you know, that's sort of the track that we're on, in not only 2021, but beyond. Having a full-scale digital solution plan is, you know, in my opinion, you know, has to be a top priority.
I think Nick and John said it best. The thing I'll end on is, again, you know, healthcare does get a bad rep, but speed and innovation and flexibility that all of you showed during, you know, the hardest of times was quite impressive and inspiring. So, you know, thank you for doing that. Patients thank you, and everyone thanks you. So, and I think the future is bright for innovation and for health systems and medical organizations.
Thank you so much. Well, thank you everybody for joining us today. Nick, John, and Patrick, thank you for your expertise, and everybody have a great afternoon.
Thanks, everybody.
Everyone.
Thanks, everyone.